This is FYI on your TV, brought to you by Hometown News. I'm Kathy Botham. I have got Angela Moore with me. You are an RPN with the Rideau Community Health Services. Welcome to FYI.
Oh, thank you for having me.
You have so many services available at the Rideau Community Health Services, and we're going to talk about just one of the things that you do, and we're going to talk telemedicine, which is a great resource for people nowadays. But let's talk a little bit about you. How long have you been there?
So I've been working with Rideau Community Health Services for 12 years as of November 14th. I was one of the founding members of the telemedicine team and at its inception, and I'm still there.
So how long has telemedicine been going on?
12 years.
At that whole time, too?
12 years. As of November 14th, a team was formed. From across the province, the Nursing Secretariat funded 191 full-time equivalent positions right across the province to start clinical telemedicine services with nursing support. The equipment had been around for quite some time, but because of resources, not in use for clinical for the most part. So the equipment was being used for meetings across hospital sites, for education for medical staff and nursing staff. And then they said, okay, let's get this moving. They had been doing telemedicine to the northern end of the province for more than 30 years at that point in time. So we brought it to the rest of the province.
Okay, now Rideau Community Health Services has doctors and has nurse practitioners?
Yes, that's correct.
Is telemedicine for more specialists, that sort of thing?
Well, so telemedicine is, it's virtual care. So just, it can be with any healthcare provider. It doesn't have to be with a doctor. It doesn't have to be with a nurse on the other end. It might be a dietitian. It could be a lactation consultant. It could be a social worker. It could be anybody that a client needs to see in the health system.
Okay, now do you most often go to their homes or do they come to your office?
So often we have them come to our office. We're often running clinics. So we have an endocrinology clinic running today out of our Brockville office. So
that is?
At endocrinology is a specialty that deals with the hormones of the body.
Okay.
So they deal with diabetes, thyroid issues, reproductive hormonal issues, and really anything that has to do with hormones.
Okay.
So those clinics, we're seeing a client every 15 minutes. So we have them come to our offices for those types of things. We will go and see clients in their own home if they're homebound. So for example, we do have one homebound client this morning who needs to see the endocrinologist. She cannot get out of her home because of mobility issues, and she's on the second floor in an apartment building. So after I'm done here, I will go and see her and get her connected with our endocrinologist, and then I'll pop over to our Brockville office and see clients for the afternoon there.
Okay, so many people don't have a doctor too, so this is a resource for them as well?
Well, there is some resources. So the folks that don't have primary care, there is the East Region Virtual Care Clinic.
Okay.
And currently we're in partnership with them trying to develop a program where we can support our regional clients more locally. The providers working with the East Region Virtual Care Clinic are nurse practitioners, and they're working out of Durham for the most part, but we did just recently find out one of the nurse practitioners is actually practicing out of BC. They're physically located in BC, but providing care here in Ontario.
Wow.
So our nursing support can provide some local system navigation for those people and for the nurse practitioners trying to help them, and then connect them to a nurse that can help them coordinate that care.
All right. Now, typically you think of a stethoscope when you're going to do a visit, this sort of thing. But this is a beautiful piece of equipment as well, too. So what have you bring with you today?
This is a digital stethoscope. It's Bluetooth enabled. So we often use these with specialists, cardiologists. We have a respirologist that we work with monthly at a Kingston Health Sciences Center.
So you're not only hearing them, the person, the specialist is hearing.
Absolutely. So we connect it using a piece of software. So then the doctor at the other end hears heart and lung sounds in real time. So just like they were present with the clients themselves. So very nifty piece of equipment and very handy. Doctors tend to love it. And then we use other pieces of equipment as well.
And this saves people from having to go to where the specialist is.
Absolutely.
You're not traveling into the city or another town or anything like that
Yeah,
either. So.
yeah, absolutely.
Wow.
Yeah, we had a very robust program before pandemic, and then of course pandemic kind of squashed a whole bunch of that. But we've worked with physicians in Toronto, in Sudbury, in Thunder Bay, just for continuance of care. And then I've also at one point hosted a second opinion coming out of Alberta for someone with a rare cancer. And there was only 2 specialists in Canada that actually specialize in that cancer. So
And
that
you were
was,
able to.
yeah, we were able to get them connected and get their second opinion and get things moving for
Wonderful.
them. So it was wonderful. Yeah.
And this piece.
And this piece is our newest program development. So we're in partnership with the Vision Loss Rehab in Ontario for diabetic retinopathy screening. So they're very nifty camera for eye screening. So
we like camera equipment here at FYI.
Yeah, we just take pictures of the inside of the eye, and then it gets loaded into some AI software.
So as soon as you click that in, it got loaded? Is that the sort of
well,
thing?
yeah, sort of. So, we'd connect it to our laptops, and then we'd go looking for the pictures that we've taken. And then we load the pictures for each client into some AI software. The AI software decides if there's an issue with the retinal piece of the eye. And then if it is, it's flagged, and then that just gets sent off to Vision Loss Rehab, and then they send it through for an e-consult to an ophthalmologist, and then the client is directly connected to an ophthalmologist for care.
Wow.
Yeah,
That's amazing. That's
it
amazing.
is amazing. Yeah.
Wow. So the training involved with this is you must be always learning,
Always learning. Well, as a nurse, we're always learning, and that's mandated by the province through our College
Keep your
of
license
Nurses.
up and everything. Yes.
Yeah, is to continue to learn. But those of us that work in telemedicine, I have a team of 3 other nurses that work with me. We really like technology and all of the impacts that we can do for clients.
And I mean, as an RPN and as an RN, I mean, the education is ongoing. You're always learning about the human body, that sort of thing. But technology on top of it as well.
Yeah, absolutely, which enables us to learn even more.
Right.
Which is, really helpful. So we can educate people as we're talking with them. And then, of course, we help to navigate those local resources too.
Yeah, this is wonderful. This is wonderful. How do people get a hold of you?
So they can reach us through Rideau Community Health Services. So through our Brockville office, our Smith Falls office, our Perth office, or our Merrickville office, ask to speak with one of the telemedicine nurses. And we can get people connected to their providers at a distance. We're always happy to advocate for anyone. We're also happy to coach people to advocate for themselves. Often people advocating for themselves with their providers is much more powerful than a third party to advocate, but we will certainly advocate as much as we can.
Because there's a level of understanding what's wrong with them too, which is, I'm sure, that you would help them out with. So
yeah, absolutely.
They know what they're advocating for.
That's right. Yeah.
Absolutely.
And nurses have more time to spend with people than the doctors do, so we're able to pull out that information that's needed. Some people aren't, they're just not quite sure, right? If something is related to something else that's happening, so we help them to put those pieces together.
Right.
Yeah.
And I'm sure people would phone to Rideau Community Health Services, and whoever answers the phone can help navigate who they should talk to.
Absolutely.
Yeah. You guys have a wonderful program, and we do this on a monthly basis. We have somebody from your agency come and talk about different things. This has been really interesting. This is amazing what you do too, and just helps people be more comfortable in their home or just get the services they need.
Absolutely.
Without having to travel. So.
Absolutely, yeah. We provide the laptops that may be needed if we're with the clients. We use our own
not everybody
laptops.
has that.
That's right. We have a large population of seniors.
Yes.
We have a large population of seniors without access to internet, without access to technology. And then we also have a large population of seniors that do know how to use technology, but very, very limited. Their son or daughters showed them how to use their tablet, get their email, maybe respond to an email that's personal, but they're quite hesitant to respond to an email that may have a Zoom link from their from their healthcare provider to do a connection. So they're just not quite sure how to do that, and we're always helping to support those.
Yes, you are. Yes, you are. Well, I thank you very much for coming here today. Angela Moore, RPN with the Rideau Community Health Services. Thank you for everything you do to help people in our community.